Please help me welcome to the stage Dr. Neil Riordan.
When we were looking for a partner for our product, we looked at a lot of companies, and RBC Life had the integrity and the history that we were looking for, and and it was a natural fit for us. So anyway, I want to congratulate RBC on 20 great years. Normally I talk to scientific audiences, so you guys are firing me up. I'm going to talk about repair stem cells tonight. I'm going to tell you a little bit about the history of where we started and how we got to this point. You know, I'm really excited about stem cells, and all the doctors that we work with are also equally excited, because I think stem cells are going to allow doctors to treat patients for things that were in the past thought to be incurable. And I'm going to talk to you about some of those cases. And I'm certain that stem cell research will improve the health of people worldwide, and more importantly, will reduce healthcare costs. So I'm going to talk about repair stem cells. We hear about all the controversy over stem cells, embryonic stem cells in particular, fetal stem cells. And in both of those cases, you know, a life has to be taken. The cells that I'm going to talk about today are in our bodies. We all have stem cells. If you're sitting in that chair breathing, your stem cells are hard at work making sure that everything is repaired in your body. And I'm going to talk in particular about the bone marrow stem cells, and there are two types. One thing I want you to remember from this meeting, because you know I'm going to say a lot of things. I want you to remember the term EPC. It stands for endothelial precursor cell. EPC. Okay? And then there are other blood-forming cells, which are the CD34 and 133s. And then in our fat, we have a lot of stem cells. And as we age, as we get fatter, we deposit more and more stem cells into our fat. Also, at our clinic, we use umbilical cord stem cells from basically umbilical cord. Once the baby's born and it's tied off and the baby's separated, the umbilical cord and the placenta are going to be thrown away in the trash. So it's actually medical waste. And nobody's harmed. These are healthy babies that we get the donations from. So there's one case that I want to talk about that highlights, it's a medical first, and it highlights the joy that we get to see in our clinic almost every week of a patient getting better. And this is a medical first of a case of psoriatic arthritis. Everybody's probably heard of a psoriasis, right? And probably heard of rheumatoid arthritis. Well, this is both, right? It's a disease that has basically a severe psoriasis component and a severe rheumatoid arthritis component. And this is really a disease of the immune system. The immune system is attacking the hair, the skin, the joints, the fingernails. So we had a young lady come to our clinic, 28 years old, from Louisiana. She had lesions all over her body. Her mother described her as looking like a leper. Her hair was falling out in clumps. She just had a few clumps of hair left. Her fingernails were split beyond recognition. Her joints were all red, hot, and inflamed. She couldn't even move her left arm because of the involvement of the rheumatoid arthritis. So here's an example of plaques of psoriatic arthritis. That's on a leg. And there you can see fingernails in the hand. And there you can see toenails, and you can see the joints being swollen. Well, what we did, the stem cells in the fat are able to control the immune system. So what we did is we did a mini liposuction. A plastic surgeon did a mini liposuction, basically took about a pound of belly fat, and then that pound of belly fat was transported to our laboratory where it was digested, and the stem cells, the repair stem cells that were found in her fat, were isolated, and then they were given back to her through her vein where they could control the immune system. She got 2 injections, and that was it. 10 months later, and we'd followed up with her on the phone all along, she said, well, I'm getting better, I'm getting better, I'm getting better. She finally came back for a follow-up, and when she walked in the door, she looked like a movie star. We had a hard time believing it was the same person. She had beautiful blonde hair down to her shoulders. All the redness and swelling in her joints was gone. Her fingernails had regrown. the only plaques she had from having horrible all over her body. I mean, she was holed up in her house for 2 years before treatment because she didn't want to be seen in public. She had 2 plaques on her chest, and she was so proud to walk around and show everybody where she'd been. So to me, that's the excitement, and we have cases like this one after another, and she was completely out of treatment options. So this is one of the things that really gets me excited about what we do on a daily basis. A lot of people ask me, how did you go from where you were to getting into stem cells? And my original career was in tumor immunology, and I worked in a cancer research laboratory, and we made cancer vaccines for cancer patients. And they were personalized cancer vaccines, so we made the vaccines out of their blood, their white blood cells that we would harvest from their veins. And the problem was we couldn't get enough cells. So then we started giving patients a medication that stimulates the release of stem cells from the bone marrow, and then we were able to harvest those stem cells, grow them up in the laboratory, and then convert them into a bigger, better vaccine. So that's how we got started. But the interesting thing we noted was that when we gave them the medication to stimulate the release of the stem cells, other things got better. People with knee problems, their knees got better. People with shoulder problems, their shoulders got better. We had a patient with a heart problem. The heart problem got better because the stem cells were released from the bone marrow and went to the areas where they were needed. So that's what really got me interested in stem cells for regenerative medicine. Why a nutritional supplement? Stem cells is only part of the story. Because we can give somebody stem cells and they home to the area of damaged tissue. But that's only part of it. They don't do all the repair. What they do is they send out signals and say, hey, rest of the stem cells, come on down. Let's fix it, right? And so one of the biggest benefits is they're recruiting other stem cells, and those other stem cells are coming from the bloodstream. So if you don't have enough circulating stem cells, then you're not going to get near the benefit. And that's what we found. Some people have fantastic responses. Some people have, medium responses. Some people don't have any responses. We said, well, why is that? And then we started looking at the number of circulating stem cells because they don't do any good if they're not available to do the repair. Our conclusion is the more circulating stem cells you have, the better the result in our clinic. So we wanted a supplement that we could give to our patients before they came to get their cells circulating, so when we inject the stem cells, they go to the damaged area, release the signals, there are more repair cells to go there and help fix the problem. And then we also wanted a supplement that we could send them home with so that those cells are still there secreting the messages. We want more and more stem cells circulating to repair the damage. So we started researching, well, what helps nourish and stimulate the stem cells in the bone marrow. And we looked at a whole bunch of natural compounds. And it's interesting that the snacks out there today, there were blueberries, there were blackberries, there were, in back here, there was some green tea. And there are a lot of natural things. And if you look in nature, really, the most colorful things you can eat typically have the most benefit. The phytonutrients that are in them have the most benefit on the bone marrow and on protecting your stem cells, nourishing your stem cells, and stimulating your stem cells. So we looked at the literature, and then we individually tested all the different items that were candidates, all of them plant-based. We identified those candidates, and then we looked at different combinations. And the one thing that was surprising to us is that when we fermented those raw materials with the bacteria that's used to make sourdough bread sour, the effect went up about 5-fold. The effect of nourishing and stimulating the stem cells went up dramatically. And that's how we wound up with this product. Once we saw in the lab, well, we have this combination that really works great on stimulating the stem cells, let's see if it works in human beings. So we did clinical trials. And we found that this product profoundly nourished the stem cells in the bone marrow and significantly increased the number of circulating stem cells that are going to help our patients get better. So moving the stem cells from the bone marrow around the body where they would be available for repair. The name of this product comes from the Greek for movement or to move, which is kine, and then of course stem for stem cells. So the product name is Kine. So I'm going to I'm going to bore you with some science. I'm going to look you in the eye and put you right to sleep. No, so I'm only going to talk about two different kinds of stem cells. One are the blood-forming stem cells, right? And they form the different blood cells in your body. And then the other ones are called EPCs, and what they do is maintain the vasculature. So these blood-forming cells, and they have fancy names because those are named for markers that are found on the cells so we can identify them, but they're meaningless. They're just a sequential number. They home to damaged tissue, right? When you break your leg, there's signals that are sent out to the bone marrow say, hey, send us some help. So these things are mobilized from the bone marrow, and they go there, and they're the first responders, and then they send out secondary signals to recruit other stem cells to repair. In animal models, when you take a rat and you give them a stroke by clamping off one of the arteries going to the brain, if you inject some of these cells into the tail vein of the rat, they go right to the stroke, and they help repair the stroke. If you give a rat a heart attack, and then you inject the cells in the tail vein, they go right to the heart and help to repair the heart. If you tease up the liver or give them a chemical that damages their liver, give them the stem cells, they go right to the liver and help the liver. So they're very good at homing, they're very good at secreting factors that tell the rest of the body to come to the aid. Now, of course, if there aren't any circulating stem cells, what's going to happen? Not a lot, right? They're sending out the signal to nobody. They're screaming in the dark to an empty room. So EPCs, now these are the cells, they're also found in the bone marrow. They also home to damaged tissue, but their primary responsibility is to keep every blood vessel in your body nice, clean, and smooth. So without a balance, if you don't have a high enough level of these EPCs, you're going to be predisposed to every vascular disease you can think of, and the two major ones that kill more people than anybody else are heart attack and stroke. 1 out of 2.9 deaths in this country is from cardiovascular disease. This is a picture. Did anybody go see the body exhibit where the Chinese, they have all these people? Wasn't that fantastic? Well, this is actually this is the trunk. The arms and the legs are missing, but this is the vasculature of a human being, where they injected into the vasculature some substance that sort of rubberized it, and then they digested the rest of the body away, and this is the vasculature. So your entire body is very dependent on the quality and quantity of the blood vessels that are supplying it. In health and disease, what is the correlation of EPCs with health and disease? Well, we talked about cardiovascular disease. There's a huge study that's been ongoing. It's called the Framingham study, where thousands and thousands of people are enrolled, and they look at risk factors. And the higher the risk factor you have, the higher chance you have of dying of a heart attack or a stroke or having one of those events. Okay? And in this study, which is in the New England Journal of Medicine, they measured the circulating levels of EPCs in patients, and they matched them up with their Framingham score. And guess what? The higher level the EPCs, the lower the score, the lower the risk they had for heart attack and stroke. And it was highly significant. And this was another study where they looked at patients who had Alzheimer's disease, and then people who did not have Alzheimer's disease. On the left, that's the number of levels going up and down, the green rectangle. On the left, those are people who don't have Alzheimer's disease. And on the right green square is people who do have, and they have a much lower level of circulating EPCs. Because these EPCs the vasculature is everywhere. I wish I had a picture of the brain and the vasculature. But in order to nourish the brain, you need these EPCs continuously circulating to repair the vasculature whenever there's a minor damage, which happens every day to everybody. And then on the right, you see this is the score, and the higher the score, the better they're doing. Okay? And so you see the line going up. So the people who are doing the poorest, they have the low level, the low score, and they have the lowest level of EPCs. So the better, even the Alzheimer's patients, the ones who are doing better are the ones that have higher circulating levels of EPCs. And this is a study with migraine headaches, and they took patients with migraines, and they took people with no migraines, and then they took people with migraines that are just standard migraines, and they took the more severe case of migraine where they have an aura, where there's bright flashing and stuff before they have the migraine. And so on the left, you'll see the EPCs are highest in people without migraines, and then the next bar over, they're significantly depressed, and those are people with migraines without the auras, and they're even more severely depressed than people who have the severe migraines. And this next slide is for all the guys in the room. This is erectile function. People with erectile dysfunction have a decreased level of EPCs, and if you categorize it by mild, see, it's people without erectile dysfunction, it would be 100. There's not a bar there. But people with mild erectile dysfunction have a decreased level of EPCs. With moderate, it's even worse, and severe, it's greatly depressed. And it makes sense because the vasculature, that goes to the penis, if there's not adequate vasculature, you're going to have erectile dysfunction. And not having enough EPCs can result in that. In summary, circulating CD34s and 133s, the blood-forming cells, are hugely important to health. They circulate throughout the body, and the more you have circulating, if you have an event, or even to prevent an event, the more that are circulating, the more repair that can go on because they home to damaged tissue and they recruit more stem cells to the damaged area. And EPCs, I think we've adequately covered that. Again, they're very important for maintaining your vasculature, for cardiovascular support. So we have 2 published studies in the peer-reviewed literature on StemKine. The first one was a pilot study done on 6 people, and then the second was a bigger study done on 18 people, and this was the conclusion of the second study. To our knowledge, this is the first study demonstrating profound mobilization effect with possible clinical significance by a food supplement-based approach. And this was published about a year ago. Thank you. And so this is a table showing basically the summary of the results. And for EPCs, at the maximum, we achieved 100%. The subjects achieved 100% increase in their circulating EPCs. The CD133s, one of the blood-forming cells, 90% at 7 days. CD34s, 53% at 2 days. And the colony-forming cells, which is sort of a deeper kind of stem cell, achieved a 45% increase. All highly significant. This is a graph showing the EPCs going up over time. It's 0 time, day 1, day 2, day 7, and day 14.
Stem cell science takes a giant...
Now scientists are finding a new source for those stem cells.
Stem cell research is making major gains.
Stem cells are unlike any other kind of cell.
One of the most important innovations
Cell
in the
research
current
has the
mission.
potential to revolutionize medicine.
You've heard the buzz about stem cells. Many scientists see this research as the most exciting breakthrough in this century. Why the excitement? Stem cells act as a repair system for the body, creating the renewal and regeneration of cells. For those with injuries or debilitating disease, stem cells offer new hope. For those of us wanting to live healthy lives, our chances for a long and youthful life have dramatically increased. How can stem cells help? When you become injured or diseased, the injured tissues secrete enzymes to attract stem cells to the damaged areas. The injury may be as simple as a bruise or as serious as a brain concussion. Upon arrival, stem cells infiltrate the injured tissue and change into healthy cells of that tissue. They also release trophic factors that assist in healing. Many of these injuries are associated with the signs and symptoms of aging. Stem cells form the natural repair and renewal system for the body at the cellular level. Throughout your life, your bone marrow and other tissues produce billions of stem cells. When young, you produce a large number of stem cells. After age 25, the amount your body produces steadily declines. It's a fact. The older you are, the fewer stem cells you have for repair. Studies show the more stem cells you have, the more effective is your ability to repair injuries and reduce the intensity of some health challenges. In 2005, Dr. Neil Riordan, a world-renowned research scientist and stem cell pioneer, founded the Stem Cell Institute. His surgeons extract stem cells directly from the patient's bone marrow, culture and grow them to great numbers, and then inject them into the patient. They have treated over 900 patients. The surgical procedure requires significant cost, time, and travel, but the results have been amazing. To deliver the benefits of higher levels of stem cells to more people, Dr. Riordan studied the nutritional needs of bone marrow. He developed a formula with a special fermentation process to nourish bone marrow, enabling it to produce a greater number of stem cells to circulate through the body. This remarkable formula is not a drug. It is a dietary supplement. It is StemKine.
What StemKine can do for the masses is it can nutritionally support the bone marrow so that it produces more stem cells that results in younger levels of circulating stem cells in your bloodstream.
In collaboration with other scientists from major universities and research organizations, a 14-day human clinical pilot study was conducted. The subjects showed a 100% increase in stem cells over a period of 2 weeks. The study was reported in this peer-reviewed publication. Later, an 18-patient study was conducted in conjunction with the same group of scientists. The average circulating stem cells, known as CD133s, peaked with an increase of over 90% on day 7 during the 14-day study. And stem cells known as CD34s peaked at an increase of 53%. As soon as StemKine became available, Dr. Riordan began hearing exciting testimonials.
In the first couple of months, I lost about 35 pounds. One of the first things I noticed is that strength seemed to come quicker. I can do 5, 6, 7 wide grip pull-ups now, and I could never do anything like that before. I have more energy. I look forward to working out more. I seem to get more out of workouts. Sex drive, that I seem to have more desire, more stamina, and so my life is enjoyable in all facets.
3-4 weeks into the StemKine, it's totally, I can throw like I was 20 again. It also improved my ankles when I run. I can tell a difference there from the impact. The next morning my ankles don't hurt like they used to. If you want to stay healthy, you have to stay active. And in order to stay active, you have to make an investment, and I think StemKine is a really good investment for your health. I'll be 51 in 3 weeks, and I feel 25.
Now I can wear heels every day, never have a problem. Go home and can walk, can run, can play with the kids. It's great.
I'm excited about our new product, StemKine. It is by far, hands down, the product to take. If I didn't take any of the other products, I would want to take this one product. It has made me feel stronger, healthier.
It just keeps me from getting as tired and keeps me from being as sleepy. It's like I have an endurance with it.
Yeah, I've been taking StemKine for 6 months. I noticed my blood sugars are more level all day. I'm more focused. It keeps me calmer. With my diabetes though, I realized when my blood sugar goes low, my golf game is nowhere to be found. It's probably shaved at least 10 strokes off my game just from me focusing.
I suffer from rheumatoid arthritis, and especially in my hips. And after I started taking the StemKine, within 2 or 3 weeks, I noticed that the pain was going away. And
I've always struggled with my weight, even though I've known what to eat and the vitamins to take. And we recently started a program at Time. I've lost right at 75 pounds. On StemKine, what my understanding is it helps go in and take the stem cells and release it from the visceral fat. Visceral fat, whenever you have it, it causes the stem cells to actually just kind of be collected, captured in the fat. So with the StemKine and other things that I've done, it helps eliminate that fat, which takes the stem cells out for the body to do the rest of the things it needs to do to keep building your body and making it better.
I've always had kind of long nails, but they would just break off when they reach a certain point, and now I have to file them. I used to file them when they broke. Now I file them because they're too long.
So anybody over 30, I would recommend you take StemKine as a daily supplement, because our bodies are older and not producing as many stem cells.
To keep your circulating levels of stem cells at a youthful level, then don't smoke, eat your vegetables, go out and exercise every day. And now science is telling us that StemKine can be added to the equation and to help support a healthy level of circulating stem cells.
Dr. Riordan wanted to make StemKine available to millions of people. He licensed marketing rights to RBC Life and its thousands of associates. If you are concerned about your health and interested in improving your opportunity for a healthier life, try StemKine. It is truly the product of the century.